He's afraid because when he gets out, he's afraid he won't have the support and the help that he needs, which is huge. That's just an enormous step for Daniel, to admit that he needs help. I noticed one day that I was starting to forget that Daniel was on the unit, which meant he wasn't causing trouble. He wasn't getting angry at people. Anger is his major issue. And every time I went to get him to talk, he was smiling. And I thought, wow, this kid's changing.
It's all on how you put yourself in front of their face. You treat them with disrespect, they're going to show the same back to you. You give them the utmost respect and you do what you're told. You follow the program, the treatment rules. Everything is fine.
None of us are born knowing how to be a parent. And certainly the more difficult kids that have those mental health issues that need to be treated in a more unique way, instinctively we may not know how to do that. So reaching out for help and getting some assistance and knowing what works and what doesn't, I think goes a long way.
One of the effective interventions that shows up in the research over the past 20 years is cognitive behavioral interventions. It's a theory that was combined with cognitive theory and behavioral theory to really take a look at how do you help young people change the values and beliefs, which we know is one of the highest correlations of new crime, and then also how do you help people learn new skills and the way to manage their lives.
The public still thinks that the only response to a crime is tough. People are not very accepting of the fact that young people in particular could go into an urban setting handicapped and not have all the tools at their disposal to make good judgments. So you just have to be tough on them.
One of the things that really makes sense about CBT and the effects of it and why it's effective with young people is you have young people who have belief systems that are antisocial or pro-criminal, and then you also have a very distinct group of kids who have a lack of skills, who have the inability to manage their own life. And so one of the things historically that the juvenile justice system's done is they've controlled their lives for them. And so what CBT really lends to is the ability to teach kids how to manage their own lives.
ORF on that first trip was fairly depressing. Education programs were functioning, but just barely. The fellas in places like ORF already have a bunch of strikes against them just because they've come out of a place like ORF. They come out without vocational skills, without the ability to write and fill out a resume, without the ability to go into a job interview and look the interviewer in the eye and shake hands and introduce themselves. There's not a lot of hope for these guys' future. To me, education is the key to any level of success these guys are going to have.
We have a huge variety of youth, some that are meek and tiny and hardly weigh anything and they look like little kids. And then we have 21-year-old gang leaders, and they're all locked in these institutions, and we're all trying to serve them. And that's a huge challenge. I don't take that lightly.
How will the SH litigation, coupled with the new best practices model, reshape Ohio's juvenile justice system? On one hand, it will thin the population down that remains in the institutions, get them better conditions, treatment, representation, and programming. But also, Ohio will take a noteworthy first step toward a more community-based model of juvenile corrections.
This is New Beginnings Residential Community-Based Treatment Center. My name is Chanel Blankham-C, and I've been working here for 8 years.
The premise here is that it is more effective and it costs less to do much more in the way of effective rehabilitation in the community. What we're doing, what the parties decided to do, stands or falls on that premise.
One of the wonderful outcomes of SH v. Stickrath is that the department now has permission from a federal monitor to replace large, massive institutions with smaller, regionally based therapeutic institutions based on cognitive behavioral treatment. If the learnings that DYS has had from Paint Creek can be helpful to other kids in other regions of the state, we will have considered that a grand slam home run.
If you look at what Missouri has done, they don't have any big facilities. If you look at what Kentucky's done, they don't have any big facilities. They have very serious offenders in both of those states, just as Ohio does. So I think it can be done. I think we can have a system that is entirely based on small community-based programs. It might not be a 4-month program. It won't be a 4-month program for many of those, or an 8-month program. But I think that model can work with any of the kids in that system.
More and more states, more and more counties, and particularly the federal government, are starting to recognize that there is benefit to public safety, benefit to taxpayers, and benefit to young people and families by employing these new evidence-based approaches. We're proud to be at the forefront of that at Lighthouse.
Litigation is a terrific tool to help move things forward, but successful reforms, I think, go well beyond litigation and having commitment at a lot of different levels.
And I don't care if it's, stealing a bike or murder. We have people that need serious intervention, and this modern day of computers and technology and all these smart people, I think if we commit the resources, we can impact those numbers.
Certainly, it's going to be a tendency for the court to remember the child as they last saw him or her. And it may have been years ago, which means this particular individual has now grown and changed, and they've learned a great deal since they were away. And again, it's advocating. It's advocating and making sure you educate the state, and especially the court, on who this child is now, and how far they've come, and how they have changed.
We need to teach people about what is the trigger for crime and how to, reduce the risk. And it's boring, these remedies, and it's expensive, and it's complicated because people are complicated. And that's why we need strong leaders to help us wade through all that. Everybody is so eager to show that they're tough, to show that they will be punitive, to show that they will have zero tolerance, that they just miss the opportunity to help people understand what the right thing is. And that's why these lawsuits are so important.
The public and juvenile justice professionals must be committed to making sure that low and moderate risk youth are receiving rehabilitation in least restrictive environments, and that youths have ongoing access to the legal system even if incarcerated. Using the SH case to fundamentally redesign a post-dispositional system that continues to support our youth is critical to much-needed juvenile justice reform.